Welcome to this update for pregnant women and their families in Australia and New Zealand at the time of this COVID-19 pandemic. Australia is now being challenged by a second wave of infections in Victoria and possibly New South Wales. The challenges to our population have returned, and there are some important new issues for pregnant women and their families that you need to be aware of. Much of the news is not good. One bit may be reassuring. First, the outcomes for pregnant women with confirmed COVID-19 infection in the United States between January and June of this year are now available. Based on the American data, we still are uncertain if a pregnant woman is more likely to get the infection than a non-pregnant woman, but we do know that the implications are more severe if she becomes infected. Women who become infected while pregnant were more likely to require admission to hospital, more likely to be admitted to an intensive care unit, and more likely to require mechanical ventilation. Overall, for women infected with COVID-19, nearly 1 in 3 required admission to hospital if they were pregnant, compared with only 5% amongst those who were not pregnant. However, the good news from America was that they were not more likely to die than a non-pregnant woman of the same age and description. Having other illnesses is very important. Becoming very sick with this infection was much more likely in women with other illnesses known as comorbidities, in particular diabetes, obesity, chronic lung disease, and heart disease. Most striking has been the observation of significant racial differences. Black and Hispanic women were much more likely to become severely ill, and this racial effect extends beyond pregnancy and is evident with COVID-19 infection at different ages and in both sexes. Second, there is increasing evidence that many people who get COVID-19 infection remain sick for a long time. Remember that nearly half of all people who get this infection have very mild symptoms or actually no symptoms at all. Most of those who do develop symptoms can expect to be sick for days or a week or two, but a proportion of people have great trouble in recovering. This is now known as long COVID. The most common problems are ongoing tiredness, shortness of breath, joint pain, and chest pain. At this stage, we will need more information to be able to calculate the exact proportion of people who develop long COVID and whether any of these people can expect to suffer long-term and even lifelong symptoms and injury. But now for some possible good news, although this comes with a big dose of caution. This week, the New York Times newspaper reported on early reports from Ireland and Denmark that the rate of very early preterm birth may have fallen during the time of their lockdowns, and by a lot. Could it be possible that these lockdowns had somehow prevented women from going into preterm labour, in particular at the very early gestational ages, when the consequences are most severe? The idea is highly attractive, but there is much more work to do before we can be sure. First, we need to see this work published in peer-reviewed journals and be reproduced in other places which also had severe lockdowns. It is possible that women during lockdowns and who went into early labour just found their way to different hospitals, creating the illusion of a reduction when in fact the overall number may have been unchanged. If the effect is real, could it be that not going to work and avoiding work-related stress and travel has indeed prevented early labour? Not likely, but possible. One thing we do know is that it is unlikely to be the result of more bed rest. We have strong evidence that bed rest does not prevent preterm birth. And we do not yet have any evidence of such an effect in Australia or New Zealand. Either way, much work on this possibility has now been launched, and I will keep you up to date on the latest information. In the meantime, we know that the second wave in Victoria and perhaps New South Wales means that pregnant women need to be as cautious and disciplined as ever. Please follow the instructions from your local government. Maintain your social distances, wash your hands frequently, and get tested if you have any symptoms. The best thing you can do for yourself and your baby is to not get infected. Together, we will get through this, but there is much more to be done, and each and every one of us has our part to play. I will be back in a week or two with the next update. Until then, stay well. Thank you.